Okay, so as it was said, I am the owner of Healing Journey Acupuncture and Wellness in Wayne and Westchester, Pennsylvania. Some of you I may have seen in real life a couple years ago, but thank you for everyone that came out tonight. And I just wanted to give you a little overview of my background. So I also had migraines growing up. They started in high school and then continued. At one point in my mid-30s, I had a migraine that lasted for 10 weeks. And everyone kept saying, no, this is just, you're stressed out, you're taking board exams, etc. But that turned out to be an aneurysm. So I spent 10 weeks trying to find some type of remedy. How could I possibly help myself? Because I was not getting help anywhere else. In that journey, I was getting acupuncture 3 times a week. And when I would get it, all of my symptoms would downgrade from, a 9 out of 10 to a 3 out of 10, but then slowly come back. There's a lot more to that, but I learned so much from that experience about how to manage a migraine. And I'm very happy to share it with you today. So we always have to give the disclaimer. I'm going to share some tips. This is not a one-size-fits-all. Everyone is different. There could be contraindications with medications that you're taking. So definitely run this by your doctor, Dr. Young, myself, or another medical practitioner. These are just for information purposes.
Megan, I'm sorry to interrupt you, but are you using headphones?
No.
Okay, there seems to be like a scratching sound. I didn't know. Everybody else is muted, so I just wanted to check in with you to see if there's something else that could be going on.
Can you hear me better?
I mean, we can hear you, but it keeps
Still scratching?
Yeah, it's sort of like, well, you know what, just keep talking. Well,
let me unplug it. Is that better?
I don't know. Let's just keep going. It's not happening 100% of the time. It's just happening kind of sporadically.
Yeah, like a static.
All right. So I have prepared a video that can be sent out to you and also some notes so that you don't have to take any notes while we're chatting. But I wanted to first give you an introduction to acupuncture. What is it? I don't know if any of you have had it before, but it's an ancient technique using hair fine needles that go into certain points near nerves in the body, just enters the connective tissue. And studies affirm that acupuncture can provide relief for chronic conditions, specifically migraine, was cited with the World Health Organization dating all the way back to 1979. So it is something that is tried and true, and a lot of my patients do find relief. So much so that Cigna, Blue Cross, Aetna, United Healthcare, if they're going to cover something, they only cover 6 to 7 treatments. One of those things is to manage your migraines. And I think that that's great, that is finally coming to be. Other techniques that I use in my practice are gua sha. So that is a light scraping technique that you do. It can be done in various points in the body, but I utilize it in treating migraine headaches with using the cervical spine, doing a little bit of release on the scalp, and then all the muscles of the back and the neck. Sometimes when migraines are affected by barometric pressure changes or allergies, we need to open that up as well. So you use a different tool and kind of work outward, and you can help to move some of that out, the inflammation out, and people find drastic relief. So I brought a couple of the tools that we use. This is a basic gua sha tool. And then this would be what I would use on your face to help suction up and pull things away from the midline. All right. Gua sha specifically for migraines, there have been studies out there that show that the treatments do build on each other. So if you're going to come in, you would come more frequently in the beginning. We would do your gua sha and acupuncture treatment, and then you may come twice in a week, and that you would do that for a couple of weeks. And usually I find that patients are reporting a 50% reduction in their frequency and intensity with that combination. So that's pretty fantastic as someone who was looking for my own treatments. That's how it worked for me. And now I'm seeing it years later in my own treatment room. Many of us also have stress and tension that we hold in our necks and shoulders. So gua sha can be administered there as well. It is pretty phenomenal. There was a study that was done using heat in one control and gua sha in the other control. And the gua sha group blew it out of the water. Heat is helpful, but many of us know that ice is actually helpful for an acute migraine phase. So I do promote using heat to loosen up the muscles of the back, but gua sha is a more effective way to get the blood to flow. And when we have fresh blood coming to the area, you're going to see a reduction in inflammation. Cupping. So many of you may have seen cupping. Michael Phelps had made that a little bit famous. Acupuncturists are the only ones out there, other than medical doctors, if they were to choose, that can do fire cupping. So they look like this, and they create a suction on your back. So in my treatments, I do what's called stationary cupping. So I'll find an area that has an area that is dense tension, or what I'll do is I'll use it as sliding cupping. So you use an oil and then create a massage out of that and help to release the entire back. And that is also shown to reduce migraine activity significantly. What happens in our bodies is that we have a lot of tension, and that builds up toxicity. So carbon dioxide, we want to get that out to the surface so that it can be eliminated. And cupping is wonderful for that. In Chinese medicine, anytime that we have a blockage in the body, you're going to have pain. So whether that's, quote, qi, which is energy in the body, we are energetic beings, or you have blood that's not moving. A great example of that would be if you have a bruise. That is blood that is stuck, does not move. If you touch your bruise, you might notice some type of pain sensation. So this is where cupping excels. But for the most part, in my practice, I find that gua sha is the most effective treatment. It takes about 10 minutes to do either one of those treatments. And I typically do it either at the very beginning or the end of the treatment, depending on when I ask the patient, what is your level of pain today? If it's a 9 out of 10, we're starting with the gua sha and then letting them ease into relaxation. If it's they don't have any that day, or for the past couple days, then I'll do it at the end as a maintenance treatment. All right, so that's a common question we kind of touched on. What does it look like when you come in for treatments? How frequent do you need to come? A good rule of thumb, I like to do a 45-minute initial intake. We do anything and everything about your health history so that I can get a better picture. Most of the time, there are other factors at play: autoimmune conditions, stress, traveling a lot, changes in barometric pressure. It could change by the season. So all of these things I need to assess in the treatment room to decide how often should you be coming in. And maybe your migraines tend to be worse in the fall. So if it's the spring, I'm not going to see you that frequently. I'm going to see you more in the fall. I'd rather you save your visits and your time and your money for when it's going to be most effective. In the interim, I also have you doing things at home. So this was already touched upon as well, utilizing meditation techniques, dietary modifications. A lot of times I like to start with adding foods instead of removing them. I think that that is much easier for someone to handle, adding leafy greens versus, eliminating gluten, dairy, soy, so many inflammatory things. We like to start pretty simple. Let's just get some new vitamins in you and then see how we progress. So for myself, I like to see my patients have a 70% reduction in their migraines within, 8 to 10 treatments, they typically get to a pretty good place, at least 50% reduction of frequency and intensity. I also like to tailor the strategies to an individual basis. So sometimes in the treatment, if the patient is happy with that, I will sit there and I will guide them through meditations. We walk through, how do you do a 3-part breath? Most of us are not taught that. We come out of the womb knowing how to do it. Babies do it. We don't remember once we get into a stressful environment. So we go through many of those techniques that you can take out of the treatment room and then work on them at home in between. We go over supplement reviews. So I use several different supplements, but it really depends on what is the root cause of your migraine? When are you experiencing them? What do you already take? What is in your diet? Do we need to supplement that? Or do we need to add other foods that would contain those same nutrients that I'm trying to put in? We talk about how can you reduce inflammation, not just through diet, but through movement. Yoga techniques are also helpful. We'll go through stretching. We'll go through, most people that are at the miles for migraine status, you are aware of blue light blocking glasses and other things to use. So I don't waste a lot of time going over that. But if someone is brand new, I definitely bring that into the treatment room as well. And another positive side effect to acupuncture that most people are unaware of is that it can help regulate your sleep cycle. So anytime we have anything going on with our brains, we need good sleep. And if you're in chronic pain, we don't always get great sleep. So that is another plus and another reason that acupuncture helps to be effective in the treatment. There are a lot of stigmas around migraines, and it is a lot of work to do a diary and all the things that, historically functional medicine practitioners will go through that with you in very great detail. I also think that it can be a little bit cumbersome to do so. Most of us have an idea of what it is that actually does cause our migraine. So were there a lot of storms this week and changes in barometric pressure? Do you drink red wine and all of a sudden you have a migraine? Aged cheeses can sometimes be a trigger for people. Keeping your blood sugar regulated is so important. And then how do you do that? What foods are the most optimal for you? Because sometimes they may be a trigger. So I really like to spend a lot of time going through and educating my patients on exactly what it is and asking them questions. I don't necessarily have them keep a full diary, but if they feel inclined and that is something that they're committed to doing, I love to go over them with them and then make recommendations that are realistic. When you don't feel well on a regular basis, it's just difficult to keep track of all of those things and it becomes a job. And a lot of times we aren't making it to our job or our social events or other things because we just don't feel well. So I try to make it as simple as possible. Elimination diets, I'm sure many of you have heard of these. They're not new. They are helpful. A lot of the recommended time periods say 21 days. 21 days is not long enough to go through that. So if you're doing an elimination diet, you are most likely incorporating anti-inflammatory foods and doing that for about 3 months, just following, a diet that makes sense and includes anti-inflammatory foods is going to ultimately make a positive impact. But again, you don't want it to consume your life. So I want to stress that. A lot of times there's other factors at play that we can't always keep up with that. Seasonal changes, changes in the foods around us. Do we have events to go to? We don't want to carry a lunchbox to a wedding because that seems strange. You certainly can, but sometimes that's just not a reality. Alcohol intake around the holidays, migraine activity tends to peak in my practice because people are going out and doing things that otherwise they would not normally do on a regular basis. So when I had talked last year, it was about, or 2 years ago, we talked a lot about the vagus nerve, and we know that some of the medical interventions have implants that work on the vagus nerve. There are other things that you can do at home to exercise your vagus nerve. So sing in the shower, you can hum, doing meditations. There are so many resources out there. If you just Google how to work your vagal tone or increase it, those are things that you can do on your own without the implant while you are working through your other medical interventions with Dr. Young, and then an acupuncturist or another functional medical practitioner. Allergy season is a real bugger for many because it enhances our already, fragile states. So there's a lot of research out there now on histamines and how they can affect our health. I noticed that several of my patients have migraines in allergy season. When that happens, we have an arsenal of tools available. You can get these from a healthcare practitioner. Dehist is something that I often recommend, and it includes several things that we would already recommend for migraines. So vitamin C, quercetin, stinging nettles, that works on the liver. Bromelain is in pineapple. It is anti-inflammatory. And then N-acetylcysteine. So that helps us to create glutathione in our bodies. All of those things are going to be beneficial, especially if you have a migraine that is related or worsened by allergy season. Getting your bowels to move, such an underrated thing. Most people do not go to the restroom every single day. When I do an intake, every person is asked this question: what is it like? How often do you go? What is the color? Is it formed? Is there any undigested foods? All of these questions help lead me to the best treatment strategy for you. So if someone is not going every day, magnesium citrate, it's found over the counter. We use it if we are getting a colonoscopy. They use that to clear out your bowels. Now that's a very strong dose, and I like to start with low doses, but once we get the bowels moving on a daily basis, that I notice is paramount in helping with migraine activity. So things that help to increase the constipation in our bodies are pastries and flours and pastas. So how do we mitigate that? Add more vegetables. They're high in fiber. You can also put ground flax seeds. So if you're a smoothie person, adding 2 tablespoons of ground flax into your smoothie or putting it in what you're baking or cooking, that can get your bowels to move as well without the magnesium citrate. If you have any questions, I'm open. You can always send me an email. I'm happy to answer and give you more information on that. Bitter herbs are also very helpful. We can find those in health food stores, or also health food stores have things, these little bottles. Herb Farm dandelion is another one. And it's also one that helps with hormonal migraines because it helps to eliminate excess toxicity in our liver. So I'm noticing more and more that patients that are coming in taking over-the-counter medications, you can get to a point, and it's called medication overuse headache. So once we're using Tylenol, Advil, other, over-the-counter meds, ibuprofen, caffeine, aspirin on a regular basis, we notice that our migraines actually start becoming more frequent and higher in intensity. This does not include the triptan family. That is not on the list. But you do want to take note of how many of these are you putting into your body, and is it, yes, it can work, but does it stop working and make it worse? So just take note of that. It can be scary to scale back on those, especially when you rely on them for pain, but get a good team ready. So find an acupuncturist local to you, start your acupuncture, and then start scaling back. Use the gua sha, the cupping, start adding more vegetables or integrating any other therapies, meditation. anything it is that helps you. We're all so different. So you're going to have different things that are going to be helpful to you, and we'll take them, as they go. But I would work with your neurologist, because they are going to be aware of which ones of your medications are going to increase that or decrease your pain, if you get to that point. So definitely make them aware of that. Also, if you're seeing an acupuncturist or a functional medicine doctor, let us know, be aware of that as well, so that we can manage you in the best way we can. Another big factor is reducing inflammation in the body. So there are supplements. We live in a society where everyone wants a quick fix. When that is the case, I recommend Vibrenza. It is systemic and proteolytic enzymes that help to reduce inflammation all over. There are so many positive side effects to it. I have not had anyone that has had a negative effect from it, but inflammation can be reduced that way. Maybe it's something that you take for 10 days. Maybe it's something you take for a couple of months. We just kind of gauge what you need as we go along with the treatments. And as we said, low blood sugar, keeping your blood sugar as regulated as you can. I know we all live busy lives. We forget to get up when we're working at our computers, but eating small snacks many times a day, hummus and vegetables, a handful of nuts or seeds, an apple with almond butter. Those are all good choices and can help keep your blood sugar regulated throughout the day and between your meals. Things that I recommend on day one, riboflavin, which is B2, that there are plenty of studies out there. Many of you probably already take it. And that is something that is known to reduce migraine activity. Magnesium, there's a lot of different forms. Magnesium, I go over in the intake after I talk to you for about 45 minutes. I'll go over and say, okay, this form and this form might be a good combination for you. A good catch-all, and it's pretty safe, is Magnesium Glycinate. You can find that on Amazon. It's harder to find in the store. You'll most likely find Magnesium Citrate in the store, and that is the one that helps you to go to the bathroom. Do not take too much of that. You will not be happy. And even so, we try to get a good balance, because even though Magnesium Glycinate does not cause you to run to the bathroom, it still has that moving effect. So it does increase motility. Ginger. Ginger, I like doing as a tincture because I don't love drinking it all day, but you can get Gaia brand or that herb farm that we talked about earlier. They have ginger. I put it in a little bit of water and just sip it down. That has many benefits, but when you have nausea from your migraines, that is especially beneficial. You can also do tea. So my favorite is Trader Joe's has a turmeric ginger tea, anti-inflammatory, and also helpful for nausea. So I recommend that, or any other organic tea that you can find at a health food store, Whole Foods. Yogi tea, you can mostly find at any store out there. And then fish oil. So anytime I'm treating someone with a brain injury of any kind, I'm often recommending fish oil, as long as it is not contraindicated for some other reason in their intake. Costco is a wonderful resource for that, actually. The Alaskan fish oil, 1400, it'll be in a clear bottle, orange capsules. That one is tested for heavy metals and potency. And honestly, it scores as high as the fish oil I was spending $60 a bottle on, and this one lasts me almost a year. So that's my recommendation there. I have my patients do that combination, those 4 things, for about 4 to 6 weeks. And then after the 4 to 6 weeks, I go over their progress, what's new. Are we going into allergy season? Are we going to add a couple of other things? B vitamins, a B complex is helpful sometimes. I like to use supplements, and I've spent countless hours going over how can we use as few supplements as possible in combination form to help with migraines, or anything I'm treating in my practice, but specifically with migraines, because you could have an entire bag full of supplements. And when we read things online, that's the first thing we do. Oh, Amazon, or go to the store and go buy this thing. There may be combination products that'll save you a lot of time, a lot of money, and a lot of pill taking, because that's not fun. So yes, the riboflavin, B2, the magnesium, the ginger, and the fish oil, those can all be started, and they're completely safe to take with your migraine medications. There should not be any contraindications unless, of course, there is something new that comes out on the market that I'm unaware of. In addition to those, I really like lion's mane mushroom. So I don't actually have any because I had to give it away today. But this brand, Host Defense, is a great one. There are TED Talks out there about this. There's plenty of information on the internet. Lion's mane mushroom, I especially use when someone is trying to cut back on caffeine. So they find that they don't have the jitters, but they do have the clarity and the energy. It reduces ADHD. It's so helpful, and also helps with migraines in general. It's pretty affordable. I think this is around $16, and this will last you, for your onboarding dose, a couple of weeks. Within 2 weeks, if you do not notice a difference, discontinue. You don't need it. It's not helping. If it does help you, get the bigger bottle and just do 1 serving a day. And then the other thing that I find personally to be really helpful is a B complex. There's so many out there. There are various forms of folic acid. So folic acid, if you've ever had a baby, you've heard of this. It's in most of our vitamins, especially if you're getting them at CVS. You will see folic acid in a B complex. About 40% of the population has some difficulty with folic acid, and that can increase some inflammation in the body, and increase histamine. So what you want to do is look for something that has folate. I use a methylfolate B complex, a liquid, so it gets in as quickly as it possibly can. I get energy. As I said, I like to mix my supplements up so I don't have to be taking 5 different things when it has it all in one. So this also has things to help with the liver, which is going to ultimately help to reduce inflammation overall. And it has the B vitamins that are helpful for me. So when I'm dragging and I just don't feel well, I go to my B vitamins. Other things that I think require a little bit more guidance, melatonin. I know that it's found everywhere, but your body can forget to make that hormone if you take it every day. With migraines, you can take it with, you can take it, and you can look up the studies as well. There's a double-blind placebo-controlled study that 3 milligrams of melatonin was actually more effective than a dose similar to 25 milligrams of amitriptyline. So I don't think that you should take it every day, but sometimes if we're in a crisis, that can possibly be something that can help you. And again, that probably goes back to sleeping. Anytime you're not getting great sleep, your migraines tend to be worse. And then we have, I'm just going to read these quickly because I'm not giving you the doses. These are things that I would work with a practitioner, medical practitioner on. So 5-HTP is another one that a lot of my migraine patients use. CoQ10 is another one, Feverfew, and Butterbur. There is a product out there by Biogenesis, MigraClear Ultra, and it does have several of those things in there, and also the riboflavin, magnesium, Feverfew, Butterbur, and ginkgo. So again, when you're looking at supplements to take, try to get more of them in one, as long as you know that they're not, one of those ingredients isn't a trigger for you.
Megan?
Yeah.
Megan, is there any information you can share, like a digital resource? I don't know if you were going to end on a tapping. Were you going to have a tapping exercise do a tapping exercise with us?
There is, and it's it's on YouTube. So Helen has it and she can send it out to everyone.
Oh, okay.
Yeah. Do we want to skip that part now and send that out?
Do you want to go to the tapping?
We can certainly do the tapping. Yes.
Okay.
All right. So let me,
We can end on that.
okay.
Yeah, and then there's some questions, hopefully you can take.
Yep, and I have a few questions for
Okay.
you too.
Good.
Do you want to start with the questions so we don't go too over? I mean, the whole tapping is in the video. So if the questions are a lot,
Oh. Yeah. I have, so
If
for
you
some,
want to, why don't we do the questions and then I'll send the tapping and people could do that at another time. If that works best, being mindful of time considerations. You had so much valuable information.
yeah, so there's so much. Yeah, I learned so much from you tonight. Okay, so if someone is not local, how do they find this type of practice that you do?
so you are, I don't know if you have, will you be sending out my information with the info sheets? My information will be on there. If you need to find a practitioner, you are more than welcome. I'm happy to do it. Just send me a message directly.
Okay, so if
find-
whoever's not local, they can reach out to you to find out how to.
To find out someone that does those specific things. Yeah.
Okay.
And then I also do phone consults. So if someone's not local and we want to go over supplements and things, I can get you started with that, or I can get you someone local in your area.
Okay, wonderful. How do you determine what type of supplements and foods to add?
So I do a very comprehensive intake. I mean, sometimes we go back to, was your birth, were you a C-section or a vaginal birth? We talk about a lot of things.
Okay,
And I like to make sure that what I'm prescribing, a lot of us have I have stage 4 endometriosis. So I have to make sure that what I'm using, ginger for me is wonderful because it's very helpful for endo and it's also helpful for migraine. So I try to use it as a synergistic effect between whatever the health profile may be.
okay, great.
Yeah.
Is there a specific type of acupuncturist to treat migraine, or are they all using these techniques?
Not everyone uses all of these techniques. A lot of times you go in and you just get a couple needles. Sometimes practitioners only treat face up. You really, finding an acupuncturist is like finding a great shoe, and finding someone that does all of these things is like finding a Louboutin. So you want to interview when you call. Do you do gua sha? Do you do cupping?
Okay,
Are you familiar with any functional medicine? Some practitioners, which I do not do a lot of the Chinese herbal medicine, I refer that out. If Chinese herbal medicine is something that you want to explore, I'm more than happy to give you practitioners that also do virtual consults and are great with migraines as well. But I have found personally that using the Western herbs and supplements has been more effective for me overall.
okay, great.
So I would ask these questions and just see kind of, most of them will do some type of 10 to 15 minute intro and get a basic idea of what you've got going on, or go into their office and see how they treat. But yeah,
So they'll
an
interview you
process.
and you interview them.
Correct. Yeah.
Yeah, okay, great. How do you feel about neurofeedback?
Neurofeedback, I have had a few patients that have done very, very well with that. Other things that have been effective for patients, we'll do EMDR. So my Westchester office is actually next to a therapist office, and patients come back and forth. So we work on, my job is to work on mind, body, spirit. Their job is to work on, emotions and spirit as well.
Okay.
And sometimes when things come up that are a little bit more traumatic, or someone isn't able to settle in, acupuncture is a great complementary therapy because we get you kind of into the zone, or we back you out if it has gone too far.
Gotcha.
So I think it's great.
Okay, good, great. And I think I have one more question. I'll double check. Does the Fibrenza have any medication interactions?
So I have the number for the owner and the developer of Fibrenza. if there are any questions that I ever come up with, I just call him. He's wonderful. They only have a couple of products. So throughout the years, I have not found anything that it truly interacts with. With having endometriosis surgeries in the past, I stopped taking it. When I had the stroke, I took it because it was natural blood thinning and also reduced inflammation and, you know, a whole host of issues. But it was very helpful for me after the fact. So, and I was on a rainbow of pharmaceuticals at that point.
Okay.
So I just call and double check if there's something that I'm unaware of, but most things, no, there are no interactions.
Okay, great.
As
Well, it
with
sounds
anything-
like you're knowledgeable. Yeah.
As with anything, we always say, don't take it with pregnancy.
Okay, great. Well, thank you so much.
Wait, one more,
people-
there's one more question.
Oh, is
Kate.
there? Okay.
Somebody wants to know how many milligrams of Beto do you recommend?
It depends on the person. And even if you were to look at these supplements that are, you know, combinations, they have anywhere from 56 milligrams to 190 to, I mean, they're all over the board. So this is where it depends on what else you're pairing it with to get the best benefit. For me, I like to start a little bit slower and then we can increase or decrease as needed. I'm also not one that's going to hand you 10 supplements at once and say, here, go take these. It's going to be a week by week basis so that we know, I had someone who had migraines from ginger. So, you know, I wouldn't have known that if I had given them 5 supplements at one time. And then the increase is something that if you're still having them, let's try to increase a little bit. But overall, I think it's a synergistic effect depending on what the whole cocktail is that I'm sending you home with over those 8 weeks.
Okay, wonderful. Thanks so much. Yeah, well, thank you very much for your time.
Thank
And-
you.
And we really appreciate it. Learned a lot today.
Great. And if you need anything, you can contact me on my website. My information's there. Also, you can follow us on Instagram at Healing Journey AccuWellness. I put up a lot of tips there as well, and you can send me a direct message. We also have a Facebook page. Don't post there often, but I can be contacted there too.
Great. Thanks so much.
Thanks for having me.